Welcome back, everyone, to part 47 of our 100-part CPC exam series. I am absolutely pumped for today's explainer because we're jumping right into a true masterclass on Chapter 21 of the ICD-10-CM. We're going to completely decode Z codes and social determinants of health. These codes literally trip up thousands of test takers every single year. But today we're making them your secret weapon. So, grab your coding manuals, get focused, and let's go.
And hey, if you want to physically shave minutes off your CPC exam time, make sure to like, share, and subscribe to Decode Healthcare with Harshal. Do it right now, because we're jumping straight into the ultimate Z-code hacks and exam elimination strategies. All right, let's dive right in. First things first, we gotta establish the foundational why of Chapter 21. What exactly are Z-codes anyway? Well, ranging from Z00 to Z99, these codes are designed to capture factors influencing health status and contact with health services. Basically, we use these to code reasons for healthcare encounters other than a direct disease or injury. Think about it. If a perfectly healthy patient walks into a clinic just for a routine sports physical, you can't code a disease they don't have, right? That is exactly where Z-codes step in to tell the story. They're for your routine exams, wellness checks, or capturing secondary factors that impact patient care. Let's break down the core mechanics of some specific categories you're absolutely going to see on the exam. So you've got the Z20 series for contact and exposure to communicable diseases. Then there's Z23 for vaccinations. Now, pay super close attention to Z23. The golden rule here is that it's reported only when a patient presents specifically to receive that vaccine. Finally, we have status codes, like Z79 and Z93 through Z99, which just flag that a patient has a specific condition or a device. Now, here is a crucial point, differentiating screening from diagnostic testing. Screening codes, which sit in that Z11 to Z13 range, are strictly for asymptomatic patients. Imagine a patient coming in for a routine wellness mammogram. If a lump is found, guess what? The screening Z code still goes first as the principal diagnosis, followed by the newly diagnosed condition code. Always code the reason for the visit first. And that brings us to a classic CPC exam trap. You absolutely must differentiate a normal status code from an actual surgical complication. For instance, if a patient has a cardiac pacemaker, you use the status code Z95.0. That simply means the device is present and working perfectly fine. Do not confuse this with a post-procedural complication code. Status means presence, folks, not a problem. So what happens when a patient is on lifelong medication? Well, that's your Z79 series. You need to rapid-fire recognize these when you're staring at multiple-choice answers. We're talking Z79.01 for lifelong blood thinners and Z79.4 for insulin dependency. Oh, and we also have codes for long-term use of oral hypoglycemics and NSAIDs. The second you hear about a patient managing a chronic condition with these drugs, your brain should instantly jump to Z79. Okay, let's shift gears to a heavily tested area, social determinants of health, or SDOH. This covers codes Z55 through Z65. Now here's the expanded clinician documentation rule you have to memorize. SDOH Z codes can be assigned based on notes from any health team member involved in patient care. The nurse, the social worker, the case manager. You don't just have to rely strictly on the attending physician's note. It's a total game changer. But why do we care so much about SDOH? The whole purpose is capturing vital socioeconomic factors that severely impact patient care. Things like housing instability, which is Z59.0, or food insecurity, coded as Z59.4. It also covers things like low literacy and unemployment. These codes tell the unseen story of the patient's healthcare landscape. They directly enhance risk adjustment and provide a complete, holistic picture of their well-being. All right, let's pivot from theory to exam execution. The 7th character rule is basically your best friend for eliminating wrong answers fast. On your exam, especially with injuries, you'll see options ending in A for initial encounter, D for subsequent encounter, and S for sequela. If a scenario says a patient is returning for routine healing, you immediately hunt for the D for subsequent encounter. Cross off A or S, and boom, you've just eliminated 2 wrong answers in 5 seconds flat. Next up, I want to introduce you to the master rule for the ICD-10-CM. Let's talk about the safe workflow. The absolute golden rule of coding is that you must stop and read the tabular list notes before finalizing any code. I mean it. The index only points you in the right direction. The tabular list confirms if your code is actually valid and tells you exactly what sequencing rules apply.
Let's cement this elimination strategy real quick. Step 1. Check those seventh characters to slash incorrect options right off the bat. Step 2, always double-check your excludes 1 and code first notes in the tabular list. Remember, excludes 1 is a hard stop. Those conditions literally cannot be coded together. If you follow this two-step dance, you will buy yourself precious extra minutes on test day.
As promised, I've put together a Chapter 21 summary cheat sheet for you. It captures the exact screening sequencing rules, the Z79 drug therapy codes, the SDOH documentation rule, and the elimination methods we just went over. Go ahead, pause the explainer and grab a screenshot for your study notes. You're going to want this framework fresh in your mind when you take your next practice test. Man, what an incredible session today. Coming up in Part 48, we are tackling the absolute beast that is compliance and regulatory guidelines. We're talking OIG work plan, NCCI edits, HIPAA, OSHA, and medical necessity. But before we go, I want you to think about this. If coding errors involving Z codes and SDOH cost healthcare systems millions of dollars annually in loss risk adjustments, how valuable does mastering this one single chapter make you as a certified coder? Keep studying hard, and I will see you in the next explainer.